This computer.
Oh, you are consenting. I've never seen that before. That it's asked your consent. Is that just something new?
I probably clicked some box that, like, in your settings, there's a lot of different things that I've probably said, like, yeah, they should know that it's getting recorded.
Yes.
So.
Okay, well, welcome everybody. Welcome Esther and Lauren to my class.
Welcome.
So Esther, we have a poll here if you want to take it, your role in the school, and you can go ahead and start working on that.
All right, I will share it. Oh, it was already being shared. Okay.
Okay. Kim Schwartz is coming in. Oh, it says for me to admit her.
I can, well, either of us can, but if you see someone and I don't, since you're co-host, you can see things. So welcome as you're joining in. Oh, it looks like another. You have found your way to practical tools for chronic disease management in schools. Welcome, welcome. As you sign in, we'll give people a couple minutes to move from their last session. If you could type your name and school district in the chat box, that would be great. And then Barb has a poll up with just a few questions as well.
Welcome, everybody. Thank you for joining. We have a new format this year for SHWE. We have a new format for everything, don't we, Lauren? Everything in our lives. It's like, oh my goodness. So yes, as you join in, please take the poll. We would like to know what your role is and which area of chronic illness management you are most concerned about.
And then can you guys see the third on your own, or do I need to scroll down? It looks like people were able to see it themselves.
Sounds good.
Looks like 2 people have voted right now, so maybe we'll give a few more minutes for.
When I press the submit button, it doesn't submit.
Check, Esther, to see if you've answered 3 questions. Sometimes you skip one on accident and it wants you to answer all 3, I think.
Welcome, Kim and Charity and Lauren Stone. Hi, all of you. It's great to have you. Hi, Lauren from up in Nenana and Kim and Charity from Ketchikan. Yay.
Hello. Great.
Hi.
I love people who who show their face.
Yes. Oh, should everybody show your faces? So
for just a minute. We understand when you can't for bandwidth, but it's nice to see. Good morning, Esther.
In the beginning, it's nice to see who's here.
Hello from Ketchikan, Kim. Thank you for recognizing us being here.
Oh, yes. Was that Kim?
Kim, yes.
It was Kim, or it is Kim.
Hi,
was.
Kim.
This doesn't sound good.
Yes, and Charity, I'm so glad you could join us, some of our brand new school nurses. Hi, Charity. How are you? Are you in Alaska or out of state still?
Let's see. She's on. Let me see if I can unmute
She's
her.
in Alaska.
Okay, good. I should look at the Alaska background. And Mark, where are you from?
Seward.
Oh, okay. What's your role in Seward?
I'm the elementary physical education teacher.
Oh, perfect. I'm so glad to have a PE teacher here. Awesome.
And Barbara, yes, I am back home. I'm on quarantine. So I'm working from home and Kim's managing the office, but I'm doing what I can from home.
Okay, great. Okay, so make sure everybody answers the questions here. We have 66% voted. Oh, it's probably my two that I have an extra screen up so everybody sees my name twice because sometimes I have internet problems. So when I present, I try to have my cell phone ready just in case it cuts out. So
okay, I'll end the poll then. Are you feeling ready for that, Barb?
Sure. Did everybody get a chance to? We have, okay, 3 out of 4. Okay, I'm just looking. Yes, that would be good. So I want to just go over what our poll questions look like. So we have, it looks like 3 school nurses, a teacher, and looks like everybody's, okay, asthma, diabetes, chronic dental are some of the things that you feel you want more education on. And you're most worried about if someone got COVID, they had asthma. So we'll go over that a little bit. And mental health, also mental health. Okay, that sounds
It
great.
looks like seizures as well was one.
Yes, seizures also was one if they got diagnosed with COVID-19. Your poll answer questions, I just did some research the last couple of days, and the students, the children that, there's very few children that have actually died from the effects of COVID, but the ones that have the highest medical incidence was chronic lung disease or asthma, and a little bit of diabetes, not very much, but it was mostly the lung issues. And seizures actually wasn't an issue, but seizures is scary for a lot of people if it happens in school. So, okay, I'm going to go ahead and get started with my little lecture here, and feel free to put questions in the chat box. I'm so glad that you joined today. We usually have a different format. Our SHWE's usually in person, so glad to have you here. So I'm the school nurse consultant, and I work for the state of Alaska in public health, women's, children, family health. And I've been in this position for 3 years now. And I was a school nurse in the Anchorage School District for over 20 years. I worked in elementary, a little bit in preschool, and middle school was most of what I did. So, okay, so we are going to talk about practical tools today for chronic disease management. Is my second slide showing okay, Lauren? Yeah, okay. So how is the pandemic affecting students with chronic illnesses? And how will you identify these students? And what is the absence like in students with chronic illnesses? And for your school nurses, what training do you need to do for your staff to make sure that they're trained properly? So this is a incidence of prevalence of chronic diseases in school. And as you can see, asthma is the highest. And I just looked at our asthma, our Alaska statistics, and they're similar. Asthma it's about 8 to 10% of our children in Alaska. And look at this, 18% of children living in poverty. So seizures is not as prevalent as well as diabetes, but diabetes is a severe illness that needs a lot of management in schools, as well as seizures. And poor oral health is actually our biggest concern, especially in Alaska here. Those of you that are working in more rural areas too, you may not have as much good dental care. That is the biggest reason why there's absences in school, because of dental caries, untreated dental caries. And of course, our food allergies would be second in line of prevalence of chronic illnesses if we just look at asthma and not look at oral health issues. So how has COVID affected our students in school with chronic illnesses? So I've been asking some of the school nurses that have had kids in school for a while, and actually I talked to Dr. Olson also, and about what she has done a lot of research. She's our physician working with our schools. And she basically said that, that most students with chronic illnesses are doing well as long as their illness is controlled. And so in the beginning, parents that had students with diabetes, in my little poll that I did, a lot of those parents chose not to have their students in school. I think now there's probably more that are in school. So that would be important that they're managed really well. Make sure that they, all the staff know everything about those students, so they know how to manage low blood sugar and high blood sugar. And so the real reason that asthma in the beginning of COVID they were saying that asthma was a risk factor for COVID. And now they've found if it's a student is in good control or an adult, that they do fine if they, they're in school, they're exercising, but if their asthma is not in good control, that's where the issue is with COVID. If they're not taking care of it, if they're not getting the right treatment. And we haven't seen any evidence that students with seizures in the midst of COVID had any adverse effects. And again, with severe allergies, they need to be in good control and have an EpiPen at school. So we have talked a little bit about emergency care plans before for you teachers. I would hope that in your school, if you have a student either with asthma or diabetes or seizures, that you would have been given an emergency action plan. And so for our school nurses, make sure that for those 3 conditions that you give your staff, especially your PE teacher for your asthma kiddos and diabetic kiddos, they really need to know what the plan is because exercise does affect both of those. And these plans are written in layman's terms, and we're going to give you an example of it as I go along. So you want to provide a safe environment. Oops, went back here. Lauren, how do I go back? Let's see. Here we go. Okay, here we go. Okay, so you want to provide a safe physical environment, both inside and out, for your kiddos that have chronic illnesses. And those that have allergies, you want to make sure that everybody in the whole school knows that that child has an allergy. Of course, your lunch lady, but also the teachers. And never allow peanuts in school. It's just been pretty much prohibited in all the school settings. And we do want to encourage all students to participate in PE, regardless of their ability. And there's few times, I mean, we've had Olympic athletes that have had asthma and they just have it in good control. For you school nurses, you want to make sure that all your staff is trained in how to treat anaphylactic reactions in school. So we're going to show you a link to the EpiPen training that's available at AFA. You want to make sure it's the Alaska Allergy Foundation of America. And they have a special training that they did with a grant from actually our chronic disease funding that we got from CDC that's available for all teachers, coaches, secretaries. Lauren, are you able to pull that up right now, the AFA link? I want to just show them what that is. Do I need to stop screen sharing in order to do that? Not sure. Are you there, Lauren?
I'm here. Let me see. I just pulled it up. Let me see if it's showing. Might have to do. Yes. Okay. Sorry.
Lauren, if you can keep your video on and then I'll know in case my screen freezes. Okay.
Okay.
Here we go. So this right here for the school nurses that are on and for a PE teacher too, this is a great site to get information from. And this right here, this portion that says the injection connection, it is a staff training that's about maybe 20 to 30 minutes that you can have your staff take, and you can actually show it in an in-service, and it teaches how to do a EpiPen administration and also how to recognize what anaphylaxis is. And it's an excellent training. Lauren, you've taken it. Do you want to make a comment about it, what you thought of it?
Right. I felt like it was really helpful. I mean, one part I loved was with Barb, I was able to do it and she let us practice actually the stab in the thigh afterwards, but good information, pretty user-friendly as a person who wasn't a school nurse. I would definitely think it's useful to share with people outside your kind of school health team at your districts as well.
Yes, and I would just during an in-service, I would just have all the staff watch this because you never know when you're going to have a student with an EpiPen or a staff member. Okay, you can stop sharing that screen. Thank you for doing that. Sure. So I'm going to start out, let's see, share screen again. Is it back up? There we go.
Back up.
Okay, so I'm going to start out talking a little bit about asthma, and also on D, there's training available. There's online training available for medication administration. And so asthma is the area that when I was a school nurse, I would make sure that my staff knew the students that had asthma and that they had an asthma action plan that they could follow, especially the PE teachers. And if, you know, it was elementary, any place like they would be, actually all the teachers, you know, in secondary school should have a copy also. So how can you get the parent to turn in an asthma action plan? Some years I had really good results, and some years I didn't. I would just say at the beginning that they have to turn that in and give them a date. And then usually I found about 10% of my kids with asthma were not in great control. So you're going to have some kids diagnosed with asthma that you probably won't ever see in your offices, or in PE, they won't have an issue with it. But if those 10%, those are the ones that you really want to make sure you have asthma action plans on. It might be higher in your school. Sometimes more kids have asthma in more rural areas, but you want to know if it's in good control. So like I said before, the students with well-controlled asthma are not at higher risk, but uncontrolled asthma, they are. So we just took you to that website. So I know of several instances in Alaska where two that I can think of where students with asthma had died. Either one was in school and one was on an outing, and there might have been one other one. And every one of those did not have controlled asthma. So that's one thing that you can be aware of. Even teachers can be asking and observing how the child is using their inhaler, whether they seem knowledgeable about their asthma or not. So we're going to talk about two areas of asthma. The first one is just a regular flare-up of asthma where maybe they need to use their inhaler in school, and then an asthma emergency. So what does happen during an asthma episode? The airways will swell, as you can see right here. I used to have a little diagram, a little model in my school. The kids loved it. So what happens when a person with asthma gets a cold is they start to have mucus in that airway. So like right in here, it starts to get plugged up and have mucus. The airways always swell, and then the muscles start to tighten, and they can't get air. Similar to when someone has an anaphylactic reaction, those airways start to tighten also, and they can't get oxygen and they can't get air. So each individual has his own set of symptoms. And so if you know a student that has asthma, you want to look at some of the warning signs. A persistent cough, it could happen with or without activity, wheezing, shortness of breath. A student they do that, retracting. They just like that. Their abdomen is kind of dense in because they can't get their breath. If I ever saw that, I would be on the phone with a student's parent, making sure that they get them in right away and to see their provider or take them to the emergency room. So what are the triggers in school? We don't really have chalk anymore, but and we don't really have animals, but mold and mildew could be an issue, strong odors. I don't know how all our COVID sanitary or hand sanitizers are affecting, but you might be aware of that if a lot of students are using like the alcohol-based products and the hand sanitizers, and if it's affecting your kiddos that have allergies or asthma. Cold temperatures, since we've dipped below zero a few times. School bus idling, that diesel smell, that has affected kids. So your kiddos with asthma and allergies, make sure that they're not standing out there that long where the buses are idling. Pollen, smoke, which we have in the summer, and pests can. So an asthma trigger is anything that can bring on an asthma episode or make it worse. And everybody's triggers are different. And some students have several triggers. So the things that can aggravate asthma are colds or respiratory issues, allergic reactions. Many students, people with asthma also have severe allergies. They're very much, they can have both. Yeah, I've had a lot of times, my asthma kiddos also had an allergy action plan. And strong emotions, crying, laughing, that can trigger their asthma too. Okay, all of you probably have seen an inhaler, and our new inhalers years ago, we didn't have metered doses, but now they are metered doses. So there's little in the back of the inhaler, it usually shows how many our doses are left. And so if you have a student that seems to be using their inhaler a lot, make sure that that medication, the inhaler, has not run out, that it still has doses left. And usually there's over 100 doses. I think it's 180 or 90 it starts out with, somewhere in there. And so the basic ingredient is albuterol, and this is the quick relief inhaler. And those of you that have had, all of you are fairly new. I know, Esther, you've been in school for a while, but make sure that the student is bringing the correct inhaler to school. I have had students bring their controller medication instead of their quick relief medication. And some students, even some parents I had, didn't really know the difference. So the quick relief inhaler is albuterol, Proventil, Ventolin, are some of the names. There's some new ones out there too that you'll have students bring in. Make sure that when that inhaler comes in, that you're going to decide whether that student will self-carry, depending on the age of the student, or whether they want to have it in the office someplace. I had, when I was doing elementary, my little first, second, third graders would pretty much, we'd have it in the nurse's office, and before PE class, those that pre-treated, they would come in and use it, and then they'd go right out to PE. And usually we like to have that done 15 minutes before, if that's on their asthma action plan. But they should ideally have access to their quick relief. As long as the doctor has written on the asthma action plan that they are trained to self-carry their inhaler, then they can. And the controller medication is really supposed to be used at home. They should not be bringing that to school. It does not give them quick relief. Some examples of that would be like Flovent is a common one. I had students bringing those to school and they didn't get the difference. So teaching those students is important to know which inhaler is helping them for what. So this is an example of an asthma action plan. And for PE, so that would be something that you'd want to be aware of. Looking at, do they need to pre-treat before they do their PE? Is their asthma in good control? Some kiddos didn't have to, and some kiddos did. So Lauren, can you bring up that copy of the asthma action plan? I put this in here. We're going to have it in the box too, as a link, so that if you want to have an example of an asthma action plan, most of you districts will have that. But I just want to show you what a current example might look like. This came from the Alaska Allergy and Asthma Foundation site, and it is usually they will tell you what is considered the green zone, what is the yellow zone. Okay, so actually, yeah, this is one of them. So we'll talk about this one first, as long as you have it up.
Oh, sorry.
So that's okay. So how do you know whether the asthma action plan is working? So this is a tool that is actually on the National School Nurse site for you school nurses that you can download. We actually have it, I think we have it in the chat box, that you can use with your students and have your parents fill this out. So these are some of the signs if their asthma is not in good control. So we're looking at who's responsible for this. Is the responsible person the school staff? Is the parent, have they been taught about it? So this is a little checkbox that the parent can actually fill out, and they can, you can ask for this, and you can have them send it back to you. So this is a really good way to tell whether they're using a controller medication. So the controller medication is a small dose of steroids, and it's used long-term. Some only use it in the winter. That they usually use twice a day at home, and that is preventing them from having severe asthma attacks. So that is something that I just found, this little sheet, and I think is great. And if I was in the schools, I'd be using it right now. So scroll down a little bit more, Lauren. So it looks like you can also use this as to monitor and check to see how the student is using their inhaler. And my little kiddos, my first and second graders, many times were not using their inhaler correctly. So basically, you know, they want to make sure that they're have a spacer on their inhaler. They take a deep breath. You know, if it's a new inhaler, you want to prime it a couple of times, but you want to make sure it's sealed around their mouth. And they take a puff and they breathe in and they count to 5, like 1, 2, 3, 4, 5. And you can count with them, and they don't want to breathe in between, and then they can let that breath out. That's the proper way to make sure that that albuterol is getting into their lungs. And then they have to wait a minute in between. Many of the kiddos are impatient, especially if they're going to be class. And you want to make sure that they wait and they do their second puff to wait a minute. So you can observe them, and that could be a goal actually for that asthma student, and making sure that their name is on it if they're self-caring. So I would encourage you to use this sheet. Okay, you can go ahead and take that down.
Do you want me to show the other one?
Yes, go ahead and
asthma
show the other
action
one. Yes,
Yeah.
that would be great.
Okay.
So the other one is an example of a student asthma action plan. So this is important because as school nurses, you will have some kiddos that have their peak flow meter there that you're going to look at just what they're, basically a simple way to explain this is their lung capacity. Our personal best is, it depends on the height of the person, but I've done my own peak flow and I'm like 5'5", and my personal best would probably be about maybe 380 on the peak flow meter. But that's a good way to tell whether that student is in the green zone, which is all clear, you know, everything's good, or are they getting in the yellow zone, which is only 50 to 80%. So in that example, for me, it would be like 190, it would be 50%, and then I would be having a hard time breathing. That would be a danger zone. So you'd want to medicate with quick relief, and then you can recheck the peak flow in 15 to 20 minutes. Some asthma plans allow you to give the inhaler again after 15 minutes. And then I would contact the parent if this happens in this zone. So as in PE class, if they start to cough, wheeze, their chest is tight, they're not getting relief from that quick inhaler the first time, I would send them in and have someone, if you have a school nurse, have the school nurse evaluate them. And probably call the parent. And this is the emergency plan. I have had students where I've had to call 911 that they have no improvement after getting their inhaler in 15 to 20 minutes. Like I said, there's a retraction, they're having trouble breathing. I've had students go right to the ER before with uncontrolled asthma, and they're having an asthma attack. So the emergency medications, usually this is listed. You want to pull it up just a little bit more, Lauren, if you can. So this, so this, the healthcare provider will say whether they've used instructions on whether they can properly use their asthma medication, and it's their professional opinion whether they can. And I've had some middle school students who share their inhaler, and then they lose the privilege of it, not allowed. Okay, so scroll down a little bit more to the second page of this. And so this second page talks about asthma management, and the parent would help to fill this out, and the student also, and it'll alert you to what their triggers are. And then the parent signs that they want this to be given at school, and they authorize the child to self-carry that they can, and then also make sure you have backup medication in the nurse's office. Many schools have a spare inhaler to use, a generic inhaler if a student needs it, but you need to make sure that you have spacers. And it's an emergency order that you could have in your school to have a inhaler available to those kiddos that need it. Okay, let's go to the next slide. Let me share again. And
Can
so
can someone who's on the line confirm that you guys can access those resources in the chat box? Does anyone see those out there?
This is Charity. Yeah, I've been able to get them.
Great.
Okay,
Awesome.
good. Okay, so go on to the, I'm going to go to the next slide here. So we talked about this already, what's on an asthma action plan. So this tool, which we talked about, we showed, is an assessment tool to find out if it's actually working for a student. And you might only have one or two students a year that you need to use this with, but I would definitely be using this now. I think it's a pretty new tool that just came out. So we walked through this. So one thing that I would be watching and talk to your PE teacher here is, can they do their PE exercises unhampered by their asthma? Can they fully participate in school and daily activities? Do they have any problems with sports? Have they missed class because of asthma? Chronic absenteeism with asthma kids is something to be aware of, because as all of us are looking at, absenteeism, of course, COVID is a year like none other, so we're going to have a lot more absenteeism. But sometimes it'll be hard to know whether it's asthma or whether it's COVID. So you just need to follow your school policy on that one. But basically, symptoms more than twice a week that require a quick relief inhaler would be a sign that asthma is not under good control. If they wake up at night because they're coughing or wheezing, and if they're missing a lot of class time, if they have to stop and rest in PE class during activities because of having symptoms. Have they ever called 911? Have they had unscheduled visits to the emergency room? So we already talked about this. Do they have a personal inhaler? Are they allowed to self-carry? Make sure that your parents know that students can bring their inhaler to school. We've had a couple incidents where in our more rural areas where the parents did not know that was allowed, and they were keeping their children home every time they needed their inhaler. So let them know that that's okay to give. We already went over this. Are they using special techniques? Are they using their inhaler correctly? So pre-treating before exercise, I've had many students do that. And so that's something that if they're going to do that, make sure it's done about 15 minutes before exercise. Have the teacher release them early. The students can keep track of that. And then not just taking it in the locker room right before PE starts. That would be something you want to make sure. Okay, an asthma emergency. Try to stay calm. I've had teachers that they have the students lay down when they're having an asthma emergency. I was like, no, they need to be sitting up. They need to be, they will know what position that they can breathe best in. So if they're starting to, they can't talk, they can't walk, their students' lips are blue, their nails are blue, then would make sure I would have sometimes a student run down to my office and tell me that the student's I can't breathe. And I'd go immediately up there running with my emergency bag. Sometimes they would, and sometimes I've had to call 911, not that often, but usually you can talk to the students, and sometimes it's anxiety and they just need to be calmed down and use their inhaler. They can get pretty frightened if they don't have an inhaler handy or they've lost their inhaler. So, but basically it's always better to err on the side of caution. And if you are concerned the student's not breathing, 911 is the best bet to call. Now I'm going to talk a little bit about allergies, and let me see how my time's doing here. Does anybody have, before I go on to that, we have a small group here, just let anybody have questions, go ahead and unmute about asthma, in exercise, or anything about anything I've talked about so far about asthma. Any questions? Nobody yet? You can also put it in the chat. Esther, did you have a question?
No, mine was on the EpiPen. I just wondered about it was on the EpiPen, and that so once all the teachers are given that a class, then they are able to give the medication. If we have an emergency and I'm not there and see a teacher was there, she can give it. Okay.
Yes. Yes, and you can train her, and I would do just like Lauren and I were talking about, make sure that you have observed her with your practice EpiPen, and that training needs to be repeated every 90 days. So yes, the teacher can give it. Sometimes the older students can actually give it themselves, but yes, the teacher can.
Yes, well, whoever is trained, they can give it.
Correct.
Yeah. Thank you.
Yes, you're welcome. Okay, so life-threatening allergies. Again, the parents need to provide you with an allergy care plan. Some years I did good with this. One year in my middle school, I had 21 students with severe allergies. That's a lot. And out of a school of 750, and I did have a hard time getting those allergy action plans in. It's very critical that they provide you with an EpiPen. Again, you can have an order to have, if you have a school nurse in the building, to have a EpiPen in the building. We are still working on having that order, statewide order that would allow schools without school nurses to have EpiPens in the schools also, but we haven't quite got that work through yet. Make sure that you know what the child's allergy is and let all the staff know what it is. This is really important. Sometimes that has been a liability issue. If, make sure that the substitutes teachers know that also, and wouldn't inadvertently allow a snack in. That's not allowed. Like peanuts to a child that has peanut allergies. It's just good to have a no peanut policy that's provided anything in the school. Some kids do have peanuts that they bring in their lunches, but severe kids with severe allergies basically would want to be at a separate table. I've had that before. If it's a very severe nut allergy, that they have their own table to eat at. I know in times of COVID, things are changing, things are different. A lot of kids are eating in the classroom. So when I was talking about the no peanuts in school, what I meant was like no staff provided peanuts or nuts, but most of the time, students are allowed to bring their own in their lunches as long as they're not sharing them. But you would want to be aware of anybody that has a nut allergy and make sure that classroom really is aware of that. Know what the signs of anaphylaxis are and be trained on how to use it. The reports actually are that there's nurses that are very anxious about giving an EpiPen. If you've never given one before, once you do it, then some of that anxiety goes away. But just know it's better to give than not give. You will save lives. The side effects of epinephrine are just an increased heart rate. It just, your heart starts to pump a little more. There might be a little bit of anxiety, but that goes away after an hour or less. And so it's always better if you are unsure or not to give epinephrine. Many foods cause allergic reactions. Sometimes the very first reaction can happen unknown. So that's why it's good to have an EpiPen, just a generic EpiPen available in your school if you're a school nurse. So food allergies occur when the body's immune system overreacts to substances that you've eaten that trigger an allergic reaction. These are the most common ones: milk, eggs, peanuts, tree nuts, fish, shellfish, wheat, and soy. So in the current pandemic, what do we need to be most concerned about with food allergies? So think about where your students are eating. And due to social distancing, many are eating in the classroom. And are your teachers cleaning those tables really well afterwards? Protein substances can stay on the tables. So if they're eating on their own desk, that is actually better, but sometimes they're eating in another room on tables, and cafeteria staff are usually really good about cleaning those tables. But just make sure that if you have kiddos with allergies or even without allergies, that any place where they're eating is cleaned properly. Teach all of you. I would teach all of my teachers in the beginning of the year on in-services to recognize food allergies and what anaphylaxis is, because like I said, you can have a very first time reaction to anaphylaxis and never had that happen before. For students with known food allergies, make sure they have an EpiPen. They are allowed, Alaska state law allows students to carry their own EpiPen on them if they're trained again. And I had some students that had a little belt and they would carry their EpiPen, and they would usually, you would also be giving Benadryl. So many times they would have Benadryl available also. So cleaning table surfaces, like I said, it should be performed before and after lunch, just like the same way it was done before COVID. And make sure that hand washing is done before and after lunch, snack and meals. And try to have them do it with soap and water instead of just wipes to remove the food proteins from surfaces. And remember, hand sanitizers are not as effective. And no food sharing, that's really important. Okay, so before yes.
Briefly giving you a 15-minute warning.
Okay, good. Okay, so questions about allergies before I go on to seizures.
Yes, I do. Hi. Yes, I was working on getting stock epi and a stock inhaler. And so I was looking on the map of Alaska of the whole states also. And most of the states gave that permission, but on Alaska, it showed that we don't have that permission. And I thought we did.
We do have permission to give stock epi. We do. So I can talk to you more about that. I'm not sure where that information came from, but okay. Yes, but it has to be a school with a school nurse. So that's probably what it is. Okay. Yeah, because we are trying to get this moved through. We need a standing order from our medical director to allow to have epinephrine in the smaller areas. So that's probably why. Does that answer your question?
Yes, it does.
Okay, good. Any other questions about allergies?
Thank you.
Any other allergy questions? Anything in the chat, Lauren? Nope. Okay, so I'm not going to spend much time talking about seizures, but you need to train your staff how to respond to seizures. I've had students have a very first seizure in school. I had a middle school student. It was very embarrassing for him. He fell down in the locker room, had his first seizure. You always want to call 911 on a first seizure. Usually if students have epilepsy and chronic seizures, there will be a seizure action plan in place that'll tell you what to do. And usually you'll be giving the diastat, the emergency medication, which now is in nasal. And there would normally be a period of time before you would give that emergency medication. Many times it's like 5 minutes and then you give that, but you always call 911 if you give the diastat. So you make sure that train all your staff in how to handle a seizure, what you do if a student has a seizure. So you want to make sure the student is safe, move all objects away, have other students out of the room. That is so embarrassing when a student wakes up and finds out that, they had a seizure, and sometimes they, keep going back here. They have had incontinence with it. So you want to time the seizure, super important. So again, teach your staff to make sure someone is timing the seizure. Probably they won't because they'll be nervous. Monitor the breathing. You want to move all the objects away and know when to call for 911. Like I said, if it's a first seizure, you always want to activate emergency services and make sure that they do have a seizure action plan. Okay, I'm not going to spend a lot of time on diabetes because it's a whole big subject in itself, but they have a right with our Americans with Disabilities Act to be in school and to participate in everything just like a normal student would. So they are allowed to have their glucometer in the classroom if they're trained and if they properly know how to dispose of anything that might have blood on it. So I would usually have students have just a little bag with them that they can, put anything, their poker back in their little case, and to make sure that their desks were clean afterwards if they're switching classes. Most times it's self-managed, And many students with diabetes can perform their own tasks. Even our younger elementary students are taught. Many times the school nurses are helping them to manage that. Many times I would have my students come in before lunch, even my middle school students, and they check their blood sugar before. But diabetes can be found, first of all, in school. I've had one case I know of where a student had lost weight and was urinating frequently, and something came up in the nurse's office, and I told the mom, go ahead and get a good physical, because there's a possibility of diabetes, and there was with that student. So basically, in type 1 diabetes, which is what we're deal with in school quite a bit, the blood sugar, sorry, that's my alarm. The blood sugar is high. I have had some students that end up in the emergency room where their blood glucose is 400 to 500, and they can actually go into ketoacidosis when their blood sugar gets up super high. Normal blood sugar is, does anybody know? You want to speak it out loud? What's normal blood sugar? You can unmute.
Well, depending on what you read, it varies, but normally it's between 9. Well, are you talking for pediatric or adult too? Because it varies.
Okay, so
from
tell me what you
age.
think.
What was that?
Go ahead, do it for both, Charity.
Adults, you normally have 90 to about 120 would be your normal range. And for teenagers, you're looking at about 60 to 150. And elementary, I don't remember right off the top of my head.
Okay, well, adults is usually, I have been checked if mine gets over 100. That's usually where they look at pre-diabetic. So basically you want to keep it under 100. And most of my kiddos, my younger kiddos, the docs want to maintain their blood sugar, especially if they have diabetes, below 120. A good range is, between 80 and 120. So, but basically if you're getting up over 150, that's a big red flag. So each of the kids will have their own range that their doc will want them to try to be in. So we want to make sure if you have a diabetic kiddo in your school that those teachers have a simple sugar that they can give to those kids. I found a carton of juice is just about the best. You can have hard candy. The glucose tablets works really well. I would have extras of those. So basically the beta cells of the pancreas cannot produce insulin, so they need to inject their own insulin. How does exercise affect diabetes? A lot. So the kiddos that exercise pretty vigorously, my middle school students, they would usually have to check their blood sugar before they exercise. Then they would usually have a snack to make sure they get that blood sugar up maybe over 200 before they started exercising, because 40 minutes of vigorous exercise, they could get very low. So blood sugar under 70 is getting into the critical range with your diabetic students, where they'd want to sit, take some a simple sugar. They would want to wait 15 minutes, check their blood glucose again before you let them leave or go eat anything with more carbs in it. Exercise for some people has a pretty significant drop in blood glucose. So as your PE teachers want to make sure that they know that and know how to monitor their students. Symptoms of low blood sugar. These are some of them: shaky, jittery, sweaty, hungry, pale, sleepy, all of those. So these are some examples of fast acting carbohydrates. And like I said, don't give like a granola bar or something with carbohydrates in it, because that will slow down that blood sugar getting up high enough. Just simple sugar is all that you want. And this is a little chart that I like to give to teachers, and it just talks about knowing the symptoms. And this is actually something that's on my school nurse website that you could access under the diabetic resources. And I just talked a little bit about this, how to treat low blood sugar. And you want to wait. This is really important here. Wait 15 minutes before giving them anything with more carbohydrate. And if they are not eating a meal right away, you probably want to give a protein snack. So that'll help them keep their blood sugar up in the long range. So you don't want them to exercise during this point when they're below 70. Okay, so these are some of the resources that we have. My school nurse site has the great diabetic resources. I'm still updating it. And that's my number there. I think most of you have that. My email is my name and with alaska.gov. Okay, so we have about 5 minutes for questions now. I would like to hear from each of you. I'm going to be doing this presentation again too. Like maybe if you have a question or what you learned, or if there was more information you would like. Does anybody have a question to start out with?
This is Lauren. I was going to ask you about the Epi for Schools website. Is that something that you have to meet certain criteria to use or to apply for?
To have an EpiPen in school?
It's a website, Epi for Schools, it's called. I looked into it a while ago to see if we could get that in its stock Epi, not for a specific student. And I was just wondering what criteria.
I've had schools get that. So go ahead and apply for it and just let me know if there's any problem with that. I'm not sure during COVID what's happening, but yes, that's a great resource, Epi for Schools. Yes. For the rest of you know. Yeah, for you gals down in Ketchikan too. So, okay, sounds good. Charity or Kim, why don't you put your videos on and tell me if you have any questions. Brand new nurses in Ketchikan, if you can put your video on. Hi.
Hi, I'm still processing.
Okay. What did you learn? What did you learn today that you didn't know before?
I really liked the information on the asthma, or just like with the inhalers, but with your, your fast acting and your short acting. I mean, I have a pretty good base knowledge in it, just having my ER background, but just having that reinforced and, understanding, a lot of parents, as you said, they don't know the difference. Mm-hmm. And that definitely, the second you said that, I could recall a couple instances in the ER where, I told the mom, go ahead and give them their fast acting inhaler, and they handed them, their Duo Neb, basically. And I'm like, no. So that was definitely something to consider, because I never even really thought about that with, educating the parents of the asthmatics that I have in the school system.
Right. It's a great place for education for chronic illnesses, because we have a lot of time with those kiddos, and in between everything you're doing, it's good to have some times, just take those moments when they're coming in, to do a little bit of teaching, here and there. So yes, yep. Great to see you. Mark, do you want to tell us, do you have any questions, or was this helpful for you, our PE teacher? Are you able to unmute?
I have no questions.
Okay.
I would comment that over the years, and I've been doing this a long time, I'm definitely seeing less asthma and less allergies, latex and peanut allergies than I used to.
Interesting. Wow. Have you ever had an emergency where you've had to, help a student with a severe asthma attack?
Many of them, but not in many years. And we, the last couple of years, have had problems getting a nurse. So it's just our secretary, unfortunately. We usually just call 911 if we have something happen. But seems like years ago, I used to have so many kids with asthma and allergies, and I'm just not seeing that at all.
Interesting. That's very interesting, because in other schools it's slowly increased. So it might be your population down there or something. Very interesting.
What I am seeing is, and I was actually talking to Carol Fink about this last week, is kids coming back from COVID, coming back to school, and I'm seeing higher rates of obesity.
Oh.
And I'm seeing that, and I'm seeing it in certain populations. Kids who have always been okay and have active parents and on a higher socioeconomic range, I'm not seeing it at all. But the other kids, I'm seeing it. And so I've adjusted my PE program. It's always fitness oriented, but even more fitness. Seeing a lot of that.
Yeah, thank you for sharing that. That actually is another risk factor for COVID, severe COVID, is obesity. I forgot to mention that one, but thanks for sharing that information. That would be really good to have. So Kim says our office is next door to preschool classes. Do you want to share what it is you want to say, Kim? I couldn't read the rest of that. There's a child who's very upset.
I think she's trying to talk about her screamer.
Yeah.
Okay, got it.
Just
Oh,
that
I
she
didn't.
couldn't
Okay.
go off mute because there was.
Okay,
some
oh,
noise.
I got it. Okay, I got it. Okay. Well, I think our time is up. Thank you so
I
much
have
for
a
joining.
comment.
Go ahead, Esther. Yeah.
Something really quickly, I just want to share. I took a class and it was new knowledge for me that Mountain Dew helped with bronchospasm. Have you heard that?
Okay, that's a really good point. I forgot to mention that caffeine helps to open airways. So if they don't have an inhaler, Coke, Pepsi, yeah, Mountain Dew is double. I would give a cup of strong tea if they like coffee. So if they didn't have an inhaler, I didn't have access to it, it just help him to settle down, give some caffeine, and it does help to open the airways. Thank you so much. That was a great point for mentioning that.
Only when it's a life-saving, then no more Mountain Dew. Other than that.
I know. Lauren doesn't like to talk about too much sugar. I know. It's a bad high sugar and high caffeine.
Okay.
But thank you all. Enjoy the rest of SHWE. Are you going to put up where the rest of the classes are?
Great. Yes, in the chat box, there's just one more session today. This 11 o'clock to noon, so you have a couple minutes so you could get up and move. That feeling you have is grief, managing strong emotions in a time of COVID-19. And thank you so much to Barb Pennington, everyone. A round standing ovation to move your body.
Thank you for joining. I love that some of our new nurses joined, and thank you, Mark, too. And Michaela, I saw you on there too. Yes, great to have you.
Great. All right. And then next Wednesday, the 24th, there will be additional sessions. If you're not registered, Pat Sidmore at alaska.gov is who I would, or look, Google Alaska SHWE and it'll come up. School Health and Wellness Institute. Thanks, Barb.
Bye.
Thank you.
Thank you.